First of all, I'd like to state that the government has already failed at trying to manage or improve U.S. healthcare. We should remember that HMOs did not arise because of free market demand, but rather because of government mandates. This HMO Act of 1973 requires all but the smallest employers to offer the smallest HMO coverage, and tax code allows businesses, but not individuals, to deduct costs of health insurance premiums. The result is the illogical coupling of employment and health insurance, which often leaves the unemployed without needed catastrophic coverage. Next, I'd like to state that less government involvement in medicine would improve the current U.S. healthcare system. Ron Paul, in his Free Market Medicine article, tells the story of a man named Dr. Robert Berry, who opened up a low-cost health clinic in rural Tennessee. His clinic does not accept insurance, Medicare or Medicaid, which allows Dr. Berry to treat patients without interference with third-party government, bureaucrats, or HMO administrators. Freed from HMO and government bureaucracy, Dr. Berry can focus on medicine rather than billing. Opening a cash basis lowers the overhead considerably, allowing him to charge much lower prices than other doctors. I'd also like to point out that private sector health options with uncertain legal statuses are blossoming across Canada. David Gatzer of the City Journal states that tells the story of another man named Baker, and he isn't a neurosurgeon or even a doctor. He's a medical broker, one member of a private sector that is rushing in to address the inadequacies of the Canadian government and Canada's government care. Canadians pay him to set up surgical procedures, diagnostic tests, and specialist consultations privately and quickly. These days, he says he's able to get 80% of his clients' care in Canada via the private sector. Baker isn't alone. Other private sector health options are blossoming across Canada, and the government is increasingly turning a blind eye to them, too, despite their uncertain legal status. Private clinics are opening at a rate of about one a week. Companies like Medcan now offer corporate medicals that include an array of diagnostic tests and even a referral to Johns Hopkins. I'd also state that single-payer healthcare offends one sense of individualism. How is healthcare not stealing? Someone else is taking money that I do not want to spend away from. Last I checked, donating is willing, theft is not. Remember that other speculations to this program is that health insurance becomes mandatory. Imagine if I pressed that we should be subscribing to newspapers mandatory, that is taking someone's money for what I think is good. Even if it is, it should be a choice for each individual to make. That is freedom, that is America. Forcing citizens to own a product or buy a service when not for collateral for others, for example, car insurance, is absurd. And to summarize my position on the Canadian single-payer healthcare system, I'd like to point out that it fails in that 1, quality, lack of investment in technology and building renovations. 2, timeliness, long waiting lists. 3, cost effectiveness, overconsumption by patients and overtreatment by physicians suggests that there's not a good value for money. 4, patient orientation. State-doctor relationship takes priority over doctor-patient relationship. And 5, accessibility. Healthcare is accessible from a cost perspective, but in actual practice, due to rationing via waiting lists, it isn't. For physicians, single-payer means single-employer, yet some proponents for a single-payer monopoly gripe about working for corporate HMOs, yet any single-payer system will surely resemble a huge HMO without any competing services. This would look like a U.S. Postal Service without competition from UPS, FedEx, email, or fax machines. The best way to expand citizens' control over their own care is to adopt a free market option that allows more choices and options. If policymakers move toward a single-payer system that tries to impose universal coverage, they will find that citizens will be left with neither care nor quality. Thank you.